I'm Dr. Ross Pengles, and I'm a rheumatologist and PhD student with the University of New South Wales and the St Vincent Centre for Applied Medical Research. Scleroderma, or systemic sclerosis, is a devastating disease where the skin and internal organs harden due to fibrosis. While there is much we don't yet know about this disease, there is convincing evidence that systemic sclerosis is an autoimmune disease, whereby a person's immune system begins to attack their own tissues. Historically, there have been very few effective treatments for patients. However, we now know that stem cell transplantation can be very effective. This involves taking a patient's own bone marrow stem cells from the blood, giving chemotherapy to remove the immune cells we think cause the disease, and then giving the collected stem cells back into the blood to grow a new immune system. The idea here is to push the reset button on the immune system. St Vincent's Hospital in Sydney is one of the largest centres in the world for this type of transplant for systemic sclerosis, and our laboratory has a large bank of immune cells collected from patients before and after their transplant. We think that by studying the changes in these cells, this will give a better understanding of both the disease and the treatment. One way we can look at the cells in the immune system is to pass the cells from a patient through this machine, a flow cytometer. First, we label the cells with special proteins called antibodies, and then the machine shines a laser beam on the cells as they pass through. We can then record what type of immune cells are present in the person's blood. We are extremely grateful for the grant Arthritis Australia has provided. This will allow us to buy the antibodies so we can label the immune cells. By seeing what immune cells are present before and after transplant, we hope to identify the culprit immune cells in systemic sclerosis, but also identify the cells that are helping to turn off the disease. By doing so, we hope to go on to investigate even better treatments for systemic sclerosis patients.